underrepresented in clinical trials for diseases ranging from diabetes to heart disease to cancers. And tonight we take a closer look at the problem and the repercussions in our continuing series, Inequality in America.
I was on my deathbed in 2016.
28-year-old Shelby Holler of Statesville has difficulty talking after a brain surgery for a cancer in her spine that spread throughout her body. Her mom, Candace, says a clinical trial was her last chance.
She drives now. She walks. She's out living life.
I know that feeling of doom.
Rhonda Long is hoping the clinical trial she learned about from Duke University helps her fight a rare form of bile duct cancer. All prescription drugs must undergo clinical trials before FDA approval, but a lack of diverse representation, typically less than 5% within those trials, is threatening the effectiveness of treatment.
If we're going to be developing new treatments and therapies for every segment of our population, then we have to understand how those new drugs work with every segment of our population.
Dana Dornsive saw firsthand how difficult the clinical trial process was when her brother-in-law was diagnosed with pancreatic cancer. Her nonprofit Lazarix helps patients like Shelby and Rhonda navigate their options and provides financial assistance for travel-related expenses. Like most clinical trial patients, they both travel out of state 1 to 2 times a month.
We would have not been able to go.
And I wouldn't be here.
That's right.
Airfare, hotels, Uber, and parking all add up.
Those prices are all over the place.
The financial burden is often a barrier to clinical trial participation in minority communities, but it's not the only one.
Historically, there have been a lot of medical injustices. And because of that, there is a lot of fear and a lot of mistrust. And that has been handed down through the generations.
Like the Tuskegee Airmen study, where Black participants were withheld penicillin treatments for syphilis, or Henrietta Lacks, a woman whose cells were taken without her knowledge and became vital for developing the polio vaccine and in vitro fertilization.
Many people go to their grave never having known that they could have participated in a cancer clinical trial.
They told us I wouldn't be here in 5 years, and I've been here 11.
It touches my heart to be a part of it and to be a part of something that is going to give other patients hope, other patients longer time to live.
Of course, a lack of transportation and childcare, less awareness and access to health care are other factors making it difficult for minorities to participate in clinical trials. But as you can see in that story, Fred, just how important these clinical trials are.
Yeah, and you go into any black barbershop and you ask to take vitals of a black man. There's always this thing because of the historical, what she said, medical injustices and distrust. That is a real thing if you've never heard of it. Wow. Fascinating topic there. Yeah. Thank you, Sarah.
Thank you for making WCNC.com your #1 choice for local TV news on your phone and in your home, and trusting us on Facebook by giving WCNC Charlotte more followers than any other local TV news source. Thanks again for making us #1.
New numbers out today show many North Carolinians are still jobless as the pandemic continues. The number of Americans seeking unemployment benefits climbed to almost 1.5 million this past week. Meanwhile, in Washington, Congress is battling over a new stimulus bill as federal unemployment benefits are set to expire this weekend. Defender Savannah Levins is asking, where's the money?
As of right now, that extra $600 a week in federal unemployment benefits is set to expire this Saturday, July 25th. Today, Governor Roy Cooper and other state leaders urged Congress to extend it.
North Carolina inching close to 2 million unemployment claims since the start of the pandemic, with more than 28,000 North Carolinians filing for the first time this week.
The problem's not going away. More people are applying for unemployment this week. Our numbers continue to climb.
Casey Wilkinson, executive director for state nonprofit Piedmont Rising, says the number of jobless Carolinians is concerning, especially since the $600 weekly federal unemployment benefit is set to expire this weekend.
If the federal benefit's not extended, it would be devastating for North Carolinians. It would mean more people facing evictions, more people not being able to put food on their tables, more people not being able to afford health care.
Governor Cooper making the same plea to Congress this week.
This extra $600 has been especially important here in North Carolina, and it'll hurt these people and our economy if their benefits are drastically reduced.
Critics have argued the extra benefits are not incentivizing people to get back to work, with many workers receiving more from unemployment checks than their usual pay.
Those critics just aren't based in reality. So you got folks that want to work desperately, but their businesses can't open because it's not safe. You got folks who would like to work very much, but they're, a top risk for contracting the coronavirus, so it's not safe for them to be out at work. These are the folks that will be left behind if you don't expand federal unemployment benefits.
Meanwhile, Congress is scrambling to agree on another federal stimulus package, which is likely to include another round of $1,200 payments to Americans.
The clock is ticking, and all eyes are on Washington right now.
The stimulus package being debated in Congress right now, in addition to those $1,200 payments, also include proposals to increase subsidies for small businesses and proposals to put more than $100 billion into helping schools and universities reopen safely. Reporting in Charlotte, Savannah Levins, WCNC Charlotte.
WCNC Charlotte News Now.
Well, MEC Pre-K announced it will reopen for in-person learning beginning in September. The program was started back in 2018 to improve access for all to early childhood care and education. The program is free and hopes to prepare students for kindergarten. WCNC Charlotte's Ashley Daly has been digging into their reopening plans. And Ashley, you also spoke with the program's director today. What did they have to say?
Yeah, this is a program that is completely voluntary, but today the program's director told me they've already received a lot of interest.
Come September 1st, 4-year-olds enrolled in the MEC Pre-K program will be headed back to school.
When you look at the youngest children and their attention span, we know that they would academically perform better if they were given the option of having in-person instruction.
Tornisha Dean is the program's director and says this year it will operate at 50% capacity, dropping from 1,600 students to just 800 spread out across multiple locations. Dean says the decision to return in person was made with guidance from county and state health officials and says a survey among parents and teachers found a majority wanted to return.
What can we do to ensure that we're putting our best foot forward? Doesn't mean that we're going to make all the right decisions by any means, but what can we do to at least initiate that for families?
Like other schools who are returning, Dean says this year will be different with new health screenings, visitor limitations, isolation procedures if any child falls ill, enhanced cleanings, and PPE.
Bleach, disinfectant, hand sanitizers, thermometers, gloves, cloth and disposable masks, just to ensure that, again, that we are setting our teachers up to ensure that their safety is in place as well.
A free program whose goal is providing equal access to early education, keeping that access open.
Dean says the program is still accepting applications for anyone interested. She says so far more than 1,000 people have applied. Ashley Daly, WCNC Charlotte.
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The Firstborn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC Weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The Firstborn Storm Team will be there for you.
5:13 now. Time to connect the dots when we make the news make sense. Toilet paper, hand sanitizer, they are back on store shelves. You can get those at most places now, but it could be a while before you can buy Clorox wipes again.
They become the must-have product during this global pandemic, disinfectant wipes. And finding them at the store isn't going to get any easier anytime soon. Let's connect the dots. The head of Clorox says don't expect a full restock of store shelves until 2021. Well, part of the problem is overwhelming demand. The industry is running into supply chain issues as well. One of the big issues, materials. The raw materials used for wipes are the same ones used for personal protective equipment. Things like masks, medical gowns, and medical wipes. This doesn't mean you can't still disinfect, Manufacturers say other products like disinfectant sprays and soap are still widely available, and they're planning on keeping increased output even after there's a vaccine, predicting that more frequent cleaning will be part of our new normal. And that is connecting the dots.
Sounds good, Larry. Thanks. The RNC just weeks away, and this morning we are learning more about how organizers plan to hold the convention safely. Wake Up Charlotte's Chloe Leshner joining us live. So, Chloe, the RNC has gone through quite a few changes in the past few months, but now it seems like some concrete plans are finally in the works.
Yeah, we know the RNC will not be the big convention it was originally supposed to be, but there is still a small business portion being held here in Charlotte. What would have brought a ton of people to the Queen City will now bring 336. That's 6 delegates from each state. They'll all be tested for coronavirus before they arrive in Charlotte and undergo daily symptom and temperature checks. Social distancing will be in place in every venue, and participants will have to wear masks. Novant and Atrium are both available for medical consults and will test people if necessary. At this point, it seems the president will not be making the trip to North Carolina. He says he'll give his acceptance speech from the White House.
To another state or some other location, the amount of money is, very enormous. So that's something to consider also. I think it would be a very convenient idea. It's something that we threw out. It would be very cost conscious by comparison to any other location.
Now, some people are questioning whether or not that's legal. Democratic House Speaker Nancy Pelosi says it's not. By the way, Joe Biden will not be making the trip to Milwaukee for the DNC. Live in Charlotte, Chloe Leshner, Wake Up Charlotte.
Of course, all of us feeling like slackers right now at 6:33 in the morning, watching these folks behind you doing jumping lunges and squats and the bike and everything else, but good for them. Chloe, thanks.
We're really desperate.
Local business owner Craig Ray applied for a government loan to keep his business going. But when his request got stalled, Craig contacted the defenders and asked, "Where's the money?"
I know that after you contacted them, things moved pretty fast.
Just glad we could help you.
If you're asking where's the money and feeling financial pressure, the WCNC Charlotte Defenders are here to help. Email us at thedefenders@wcnc.com. We're there to get you answers to where's the money, only on WCNC Charlotte.
Now, time to connect the dots when we make the news make sense. The coronavirus pandemic has upended just about everything in our lives, and now this thing could be coming for Halloween.
COVID-19 is not going anywhere anytime soon, and it could even put Halloween in jeopardy, which would be a big blow to the economy. Let's connect the dots. Halloween is one of the holidays we spend the most money. In fact, it's just behind Christmas. Last year, we spent $9 billion on candy, costumes, decorations. One expert predicts that it will be cut in half this fall. Candy companies already adjusting. Hershey says they're ramping up production of at-home Halloween kits. Retailers are also going to lose out big bucks as less folks buy costumes. Many popular attractions also canceling their spooky celebrations. In our area, Carowinds is one of the biggest events every single year. But we know it won't happen as the amusement park is closed. Good news is Halloween is on a Saturday this year, so hopefully folks can still find safe ways to celebrate at home. And that is connecting the dots.
WCNC Charlotte News Now.
Time now to connect the dots when we make the news make sense. We're learning new things about the coronavirus every single day, and we're sharing them with you right here on Wake Up Charlotte. But now a new study shows just how dangerous this virus is, even to people who barely showed any symptoms.
New evidence suggests the long-term effects of coronavirus could be more serious than we thought. Let's connect the dots. The new research found 78% of people diagnosed with COVID-19 showed evidence of heart damage weeks after they recovered. The study looked at 100 patients who had not experienced symptoms related to their heart while battling coronavirus, and the patients were mostly healthy before their COVID-19 diagnosis. Most had recovered from coronavirus at home, and 18% had never even had symptoms. The damage found included inflammation of the heart muscle and the protective tissue that surrounds it. What researchers don't know is how long this heart damage sticks around. The patients in the study were put through an MRI 2 to 3 months after their diagnosis. A troubling sign as we learn more about the long-term effects of the coronavirus. And that is connecting the dots.
Download the WCNC Charlotte News app and find out why WCNC.com is the #1 choice for local TV news on your phone and in your home.
Sports Tonight, the biggest school district in the Charlotte area is trying to clear up confusion over the plan for fall sports, including football. Good evening, everybody. Thanks for joining us. I'm Sarah French.
And I'm Fred Shropshire. Charlotte Mecklenburg Schools making it clear tonight no final decision has been made. That despite a survey the district sent to the High School Athletic Association indicating it did not plan to allow sports under Plan C remote learning. Sports Director Nick Carboni has been following this story since it broke this afternoon. He joins us with the latest developments.
Yeah, that's right. The Charlotte Mecklenburg superintendent clarifying tonight that these were just answers to a survey and that no final decisions have been made. On Thursday, we obtained a copy of a survey given by the State High School Athletic Association in which Charlotte Mecklenburg schools answered no to the question, would you allow sports under the Plan C schooling option, which would be 100% virtual learning? Superintendent Ernest Winston offering this clarification tonight, saying no ultimate decision will be reached until the NCHSAA announces information regarding the fall season. On Thursday, the association announcing another delay in the start of fall practice, which were recently slated to begin September 1st. There's no new date, but after a review process, the association hopes to have a sports calendar released by August 17th. CMS sports programs have not been allowed to participate in summer workouts, while neighboring districts like Union County have been working out since July 6th. One question in that survey asked if districts would prefer to play sports in the spring semester if seasons do not start by late September. CMS answered yes to that question. But again, it's just a survey and no final decisions have been made. For WCNC Charlotte, I'm Nick Carboni.
For the biggest school system in the Charlotte area, planning the new school year with a focus on virtual learning. But what happens to bus drivers, cafeteria workers, and other CMS employees who don't have a role in that plan? New at 6, WCNC Charlotte's Tanya Mendist took that question straight to the superintendent.
If students aren't going back into school buildings like this one, that means there's a lot of staff members who may not be needed this fall. Superintendent Ernest Winston tells me today that he is concerned about how he's going to be able to keep them on the payroll.
Unemployment money is up in the air, and so is the job security for thousands of CMS employees.
But I am worried. I am concerned.
The cafeteria workers, bus drivers, and teaching assistants, the ones who aren't needed when school is virtual. How do you keep them on the payroll? It's a question that's plaguing CMS Superintendent Ernest Winston.
You know, one of the things that keeps me up at night is the fact that if we are in a remote learning environment for a prolonged period of time, that is certainly a challenge that we will have to look at and overcome.
Winston says 2,100 employees could soon be in that boat, and it costs nearly $4 million every 2 weeks to pay them. We've talked to some of those workers who didn't want to be identified when their jobs could be on the line.
It's really hectic not knowing where we stand as drivers because we make the school system keep rolling.
Winston says CMS is looking at providing new work assignments, getting the non-exempt employees new training and professional development. But what they need most, more money to keep as much of the school staff on the books as long as possible.
We will continue to advocate on their behalf for additional resources that would allow us to continue to compensate them and provide alternative work.
We also talked about the teachers who flat out just don't feel safe coming back. For the ones who do have health conditions, there are provisions that the district has put in place. But for people who just don't feel comfortable, the superintendent says he's going to work with those teachers, but he cannot guarantee them a specific job or placement. Reporting in Steel Creek, I'm Tanya Mendist, WCNC Charlotte.
Tornadoes to tropical storms, severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The Firstborn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The First Warn Storm Team will be there for you.
Right now, local bus drivers are facing new challenges when it comes to protecting students on board. Wake Up Charlotte's Chloe Leshner joining us live. So, Chloe, keeping students socially distant in the classroom is one thing, but the bus presents its own set of problems that drivers are now going to have to deal with.
Definitely, Carolyn. Bus drivers already have a huge responsibility. They have the lives of dozens of kids quite literally in their hands. But for drivers in the districts that are going back for in-person learning, the job now comes with a new to-do list.
It's the first step of a very different school experience for kids this year.
We've always worn many hats as driver.
But there's a new hat, making sure kids are following the health and safety guidelines on board. Students will be spread out and required to wear masks, a sign of the times, but not something every kid will be comfortable with.
We just got to have 100% compliance. There are going to be some folks that wear them below the nose, someone that, take them off.
The adult on the bus is in charge of the bus.
This bus driver has been in the business for years, but wants to remain anonymous out of fear of retribution. They know it's a big change, but say if they set the ground rules and talk to kids about why it's so important, the trips can run smoothly.
With distractions, you're going to have those every day, all day, no matter what job you're in. But you have to stay focused and know that you've got these children's lives in your hands.
And some districts in our area are asking the families that are able to drive their kids to school this year. Live in Charlotte, Chloe Leshner, Wake Up Charlotte.
And as we know, that's not an option for a lot of families, unfortunately. Chloe, thank you.
Here, 5:30, one young lady in Charlotte is stepping up to help others. She saw a need for her father and was inspired to do the same for many others on the front lines of this pandemic. WCNC Charlotte's Ruby Durham has this reason to smile.
Asta is a rising junior at Audrey Kell High School. Her father, a pulmonologist, is working on the front lines of the pandemic at Charlotte's Novant Health.
Every day he goes to work. He wakes up early. He works long hours, and still he manages to put a smile on his face.
But the teen's father would tell her how he and his coworkers' ears would get sore from wearing masks all day. So she decided to take action.
It hurt me to see all the pain they were going through in order to help us.
Ear savers are stretchable bands that attach to face masks and prevent the elastic from digging into the skin. Since April, Asta has crocheted over 350 by hand to send to those working tirelessly in the healthcare system.
They come in different colors. When you have a mask, you take a button and you put it around the strap. And then you wear your mask normally. And then around, you strap it back here. And so it's secure.
The cost? Nothing at all, but the response from the community after posting her efforts to a neighborhood app, overwhelming. Not only has Asta donated ear savers to Novant, healthcare workers at Atrium Piedmont and Novant Health Centra in Lynchburg, Virginia now have protection they need while wearing masks.
I also made cards with positive messages for patients and elderly people.
So far, she's raised $450 from donations, money that will go towards organizations like CMS Valentine Families in Need and Hot Meal and Care Packets for Charlotte Homeless.
It just inspires me to work harder and inspires me to help others because of the way he's also helping so many people during COVID. He's making me want to do it even more.
Reporting for WCNC Charlotte, I'm Ruby Durham.
Thank you for making WCNC.com your #1 choice for local TV news on your phone and in your home, and trusting us on Facebook by giving WCNC Charlotte more followers than any other local TV news source. Thanks again for making us #1.
Time now to connect the dots when we make the news make sense. Social distancing has become the new norm, but it can still be hard to do sometimes, self included. And experts are finding that some people are just naturally better at it than others.
If you've been having trouble social distancing, your brain may be to blame. Let's connect the dots. According to the University of California, your working memory plays a key role when it comes to your ability to practice social distancing. The working memory is your brain's ability to hold on to information for a brief period of time. Research indicates that those with a higher working memory are more likely to distance themselves from others. Experts say this is because social distancing as a new normal requires an intentional decision process, tapping directly into your memory. Researchers believe the act of social distancing will become more habitual for many people, but it won't happen overnight. So if you've been struggling to keep that 6-foot distance, you're going to have to put a little bit more mental persistence into it. And that is connecting the dots.
WCNC Charlotte News Now.
Breaking news from the top of the show. North Carolina will stay in phase 2 of reopening. That means bars, gyms, movie theaters, and event venues have to stay closed. We want you to weigh in. What will you miss the most? You can cast your vote on our WCNC mobile app. WCNC Charlotte's Kendall Morris joins us live. And Kendall, the governor's extension takes us past Labor Day. So what does this mean for local business owners?
Well, Sarah, we were with the owners of Jeff's Bucket Shop during the governor's news conference. They were very hopeful that today would bring good news, but instead it only adds to the roller coaster of disappointment. Now, Jeff's Bucket Shop, it has been closed since the middle of March. It has repeatedly been left out of the plans to reopen because it does not serve food in addition to alcohol. Almost every other restaurant with a bar on Montfort Drive around it has been allowed to open. The owners say that the reality of this pandemic is really starting to set in financially, and it gets harder day by day. Now that they have to make it 5 more weeks without any income, the owners say it's unfair when so many other businesses are allowed to make money.
Why do we have to pay the price for everything? Nobody else is picking and choosing who's going to be a winner. It's cherry picking. So why are you making private bars suffer?
Yeah, very emotional reaction to this news today. Now, bars, gyms, entertainment venues, they will all have to wait until at least September 11th now before they are given the green light to reopen. Live in South Charlotte, Kendall Morris, WCNC Charlotte.
All right, Kendall, thank you. And looking back at our poll question right now, most people say they miss gyms the most. I know, Fred, you and I both miss our gyms.
Oh, yeah, sure do. Tough go for those businesses. All right, well, let's
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The First Warn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The First Warn Storm Team will be there for you.
Here in Mecklenburg County, and tonight Health Director Gibby Harris is talking with us live. Thank you so much for joining us tonight, Gibby.
I'm happy to be here.
Well, we want to start with a statement we heard from Novant Health yesterday that our area is past the peak of COVID-19. Do you believe that's true, and what do you think we can attribute it to?
It's difficult to say that we're past a peak because I think what we're seeing and have the potential for seeing going into the fall is a matter of waves as opposed to a peak. But I do see that we have, to some degree, managed this particular situation that we have going right now, and that we are not seeing the ongoing upward situation that many other communities are seeing right now. We've stabilized, and we're managing in a way that we can keep it in a place where the hospital systems are able to take care of the patients that they need to take care of, and the people that need to be tested are able to get tests. And those are a couple of things that we've been focused on. Our positivity rate has not gone up. It's been stable, and we are seeing some stability in our social distancing as well. All good signs for us. Of course, we'd like to see everything going in the opposite direction, and we'll continue to work on that. But right now, we're at least managing this infection in the county.
I want to go back to testing. We know that testing turnaround time has been a big challenge in the county, many results taking as long as 5 days. What's causing that delay, and what needs to happen to fix that?
The situation we've been seeing as we've increased testing, because we knew we needed to do that, is that it has stressed our laboratory partners. They have not been able to keep up with the number of tests we've been sending their way, and that has just lengthened the turnaround time on test results. They have been working hard to be able to address that situation. And so we're seeing those turnaround times come back down again. We've gotten up to almost 10 days, which is really not terribly helpful to get tested and have to wait 10 days for results, because at that point you might be well. But now we're closer to 3 to 5 days, and that seems to be continuing to improve.
Yeah.
The reality is we do not have sufficient testing in this country at this point to do the high level of testing that we'd like to do to really be able to see what we've got going on in our communities. And until that capacity increases, we're just trying to make sure that those who really need to be tested have access.
Yeah, and really quickly, I know you're part of the advisory team guiding CMS's decision about schools. What are some of the metrics you think are most important when you decide when students can return to school on a more consistent basis?
Well, I think there are some metrics, and then there are other issues that we have to consider. The metrics that we are looking at, again, are our positivity rate. We'd like to see that come down a little bit before we start putting too many people together in large groups. The other issue that we continue to watch is our hospitalizations, because we need to make sure people have access. But we also need to make sure that our schools have what they need to be able to provide safe environments. And so it's the planning along with the metrics, along with people's comfort level in sending their children to school, that will make a determination around that, I believe.
And finally, a question from our Facebook page. Jennifer wondering about the treatments being used at local hospitals. Are doctors in the Charlotte area using drugs like hydrochloroquine? We've heard so much about to treat those fighting severe cases of COVID-19.
There are some medications that are being used that seem to be promising. Both of our hospitals, I think, are participating in some studies around some of those medications. The hydrochloroquine is not one of them. At this point in time, I think there was a possibility of participating in some studies around that, and both hospitals declined based on the fact that at this point there does not seem to be any evidence that that's terribly helpful in treatment of COVID-19, not to mention the side effects that go with it.
Thank you so much for taking the time to talk to us live here in our newscast. We really appreciate it.
Ashley, thank you so much. Certainly a scary situation there. Well, switching gears, teachers in our area are certainly gearing up for what's going to be a challenging school year. We know that Union County teachers expected to go back to school Monday. So in addition to stocking up on the usual school supplies, as well as the expected disinfectant supplies that they'll need to keep their students and themselves safe, we're also seeing them take additional measures outside of the classrooms to protect themselves as well as their families. WCNC Charlotte's Tanya Mendez joins us now to talk more about these measures as well as how the district is responding. Tanya.
Well, there are still plenty of teachers who feel like back to school should still be at our dining room tables, worried that they're not safe enough to go into a classroom. Today, I took that concern to the superintendent of Union County Schools. He tells me for now, he's committed to his plan. In just 1 week, teachers in Union County are expected to report to school.
Right now, that is the plan moving forward.
But for some teachers, the back-to-school list includes buying life insurance and updating a will.
But this is a bullet we can see coming. It has to stop. We have to stop it.
Dozens driving home their push for full remote learning. In a motor march Monday outside of the Union County school offices.
We are trying to persuade the board to go to remote learning to start off. We just want to see the numbers come down.
WCNC Charlotte sat down with Union County Superintendent Dr. Andrew Houlihan. He says he does feel pressure now that CMS has switched its plan to full remote.
In some regards, all eyes shift to other counties around CMS since they are the largest in this area. But we also try to balance that with local decision-making processes and our local health experts.
Under Union County's plan, students will be split into 4 groups and will receive in-person instruction 1 day a week, trying to cap capacity at 25%.
You're only going to see between 8 and 12 individuals in that room with you in terms of students, along with the teacher.
Houlihan says despite demonstrations, he believes he will have enough teachers willing and able to show up next week.
As of right now, I feel really confident.
Union County did survey its 5,000 staffers to find out how comfortable they feel going back to school. The superintendent said the vast majority plan to show up for face-to-face instruction. I'm Tanya Mendez, WCNC Charlotte.
We were really desperate.
Local business owner Craig Ray applied for a government loan to keep his business going. But when his request got stalled, Craig contacted the defenders and asked, "Where's the money?"
I know that after you contacted them, things moved pretty fast.
Just glad we could help you.
If you're asking where's the money and feeling financial pressure, the WCNC Charlotte Defenders are here to help. Email us at thedefenders@WCNC.com. We're there to get you answers to where's the money, only on WCNC Charlotte.
Yeah, the classroom is one thing, but how do you keep students at a safe distance on the school bus? It's a big challenge, and a local school district is showing us how they plan to make it happen. WCNC Charlotte crew boarded a bus in Lancaster County. New at 6, Tanya Mendes gives us a first-hand look.
Back to school means back to the bus stop in just a couple of weeks, but putting kids in a confined space is certainly something that gives a lot of parents anxiety. So we decided to tour to see what one school district is doing, and some of what they're doing and not doing might surprise you. Schools across the Carolinas buckling up for what could be a bumpy ride.
Review of what we did earlier.
But trying to make sure the trip to and from school is as safe as possible.
So we feel like we've got a good plan in place.
Lancaster County School District's Director of Safety and Transportation boarded a bus with WCNC Charlotte Tuesday.
We'll be marking these bus seats off to be able to put some distance between the bus driver and the rest of the group.
The first 2 rows out of use, and capacity will be cut in half.
Even though that we could go up to 2/3 capacity under the state rules, we're going to keep it at 50%.
But an average school bus has just 22 rows. So with 33 kids on board, that means not everyone will have their own seat.
There will never be more than 2 children in a seat. If at all possible, we're going to try to put siblings together.
Which is why masks are mandated.
We just got to have 100% compliance.
But since kids will be kids,
there are going to be some folks that wear them below the nose, someone that, take them off.
They're planning to open the windows and the hatches, and cleaning will be critical.
So they'll go through 2 deep cleanings per day, and they'll go through a wipe down process after every run.
97.2.
Vaughn says what you won't see, temperature checks. Believes that close contact is too risky for the drivers.
Because most of our bus drivers are vulnerable adults because of their age.
Lancaster pushing back the start times to allow drivers to run more routes with fewer kids on board. Not sure what's around the corner, but vowing to keep their eyes on the road. Instead of having kids waiting on the bus and getting on the buses, many school districts are encouraging as many families as possible to drive their children to school. I'm Tanya Mendes, WCNC Charlotte.
WCNC Charlotte News Now.
Business owners are all over North Carolina planning to remain closed for another 5 weeks. Governor Roy Cooper making that announcement today, saying the Tar Heel state will stay in phase 2 until at least September 11th. That means bars, gyms, and entertainment venues have been shut down since March. Months going by with little to no business. Vanessa Rufus shows us the data at the heart of the decision and the response to it.
Phase 2 was originally set to expire Friday afternoon. Now news of its extension again has many business owners reeling.
So my business plan, I modeled a 30% reduction in business for whatever reason, recession, whatever, a 50% reduction. Nobody plans for 100% reduction.
And for Orange Theory Fitness owner Jay Thomas, that business shutdown is going on 5 months. It will be at least 6 by the time he can possibly reopen.
We had, prior to the shutdown, over 140 employees, and we kept them on the payroll for 2 weeks after we shut down on March 16th, and then we laid them all off except for 5. That's the toughest day of my life. Very emotional day.
Well, health officials say North Carolina's coronavirus metrics have shown improvements, leveling but elevated daily case jumps, stable but above target positive test rates, and the start of stabilizing hospitalizations. Governor Roy Cooper says he can't chance a backslide with schools reopening soon.
Stable is good, but decreasing is better. And while we are seeing stabilization of our numbers, that doesn't mean we can let up.
Thomas believes safe indoor workouts are possible and says it's something he's done at his Rock Hill location.
For now, his outdoor workouts will continue across state lines. He hopes that soon everyone will be back inside together.
Social distancing, enhanced cleanliness, all that is effective, and I think we could do it safely if given the opportunity.
And this is the third extension of phase 2. The state has spent 11 weeks under it now, and it will be at least 16 before it is possibly over. Vanessa Rufus, WCNC Charlotte.
Download the WCNC Charlotte News app and find out why WCNC.com is the #1 choice for local TV news on your phone and in your home.
A warning tonight from health experts. Vaccination rates are down during the coronavirus pandemic. That means your family could be vulnerable to dangerous diseases. WCNC Charlotte's Brianna Harper is live tonight to explain how action now can prevent further issues later. Brianna?
Yeah, Fred, of course, COVID-19 is a top concern for so many, but public health departments, just like this one, are still offering their services to help prevent the spread of other illnesses, too.
We don't want a big outbreak of all these illnesses that are so easily preventable.
Which is why doctors say vaccines are so important now more than ever.
Influenza is probably the most important vaccination, because if you get a respiratory illness and then you get COVID on top of that, it could have deadly consequences.
Especially for high-risk groups like pregnant women, those who are older, and young children. As hundreds of students prepare to go back to school this fall, their immunizations are likely required.
They do not have the immunity that the rest of us have, and there are other diseases out there right now other than COVID.
Like mumps, measles, and polio, all very serious diseases and potentially deadly.
Some of those illnesses are making a comeback. So again, now's the time to get those vaccinations.
That also includes the flu vaccine. Doctors saying it's better to act now than later.
Into August, early September into October is a great time to go ahead and get vaccinated before the influenza season ramps up.
And the Mecklenburg County Health Department also plans to host a back-to-school immunization clinic where they hope to get students vaccinated before they head back into the classroom. Now, this will all be happening this Saturday here at the Beatty'sburg Public Health Department from 8 a.m. to 5 p.m. But if you do come out, you want to make sure you have your mask. Reporting live, Brianna Harper, WCNC, Charlotte.
Very important for people in the community to know. Brianna, thank you. New at 5:30, we are just 13 days away from children returning to Gaston County schools for the first time since the start of this pandemic. The school board voted for students to alternate between in classes 2 days a week and online instruction the rest of the week. WCNC Charlotte's Brandon Goldner spoke to a mother who argues the school system's planning is leaving out her son and many more just like him.
Thank you. Thank you.
Even a quick trip to Rankin Lake Park,
where are we going?
Requires Charlotte Floyd to consider a lot of questions.
Who I was going to be there, what's the lighting, what's the sounds.
Her 5-year-old son AJ has nonverbal autism. He can't say in words what he's thinking, and certain things can get him overly stimulated.
You have to have a plan, and then the backup plan, and then the backup plan to the backup plan.
It's why a few weeks ago she logged into the Gaston County School Board meeting to see what their plan was to get students back in class safely during the pandemic.
While looking at that board meeting, I was so frustrated at the beginning of it. And then by midway, I was like literally in tears.
Because of this moment in particular, about an hour and 49 minutes into the presentation.
One quick question. Can you elaborate a little bit more on the special academic services?
So, yes, sir, and that's at the bottom of that slide that we...
Oh, and by the way, my son was a side note. It was almost like to be continued, or we'll figure that out later.
She feels the school system hasn't been upfront in how it will accommodate children like her son who will be going into kindergarten. She says she's told the school system her concerns, but no one's addressed them. During that board meeting, Associate Superintendent Dr. Melissa Balknight says students with special needs will get the services they require, particularly during in-person instruction days.
They cannot go away. They will not be taken away from students. It may look different on the days that they're at home, but they'll receive those services.
Oh, you want to squat down like me?
Except Floyd still has unanswered questions, like what exactly is the plan?
My son deserves education, and I don't see it being taken care of.
The county says in a statement parents with concerns should contact them and they would work to address those issues. In Gastonia, Brandon Goldner, WCNC Charlotte.
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The Firstborn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The Firstborn Storm Team will be there for you.
We know there's nothing better than a visit to Grandma and Grandpa's, but unfortunately, due to the COVID-19 pandemic, we've had to keep our distance. We know that older folks are at higher risk of complications due to COVID-19, but doctors say that careful planning and precautions can make it possible to visit older relatives safely. Wake Up Charlotte anchor Carolyn Bruck is here to explain why it all starts with assessing our own health.
Do we have any symptoms of suggestive of coronavirus? And if we do, it would be important to have ourselves checked and also be very judicious about waiting so that the symptoms are not with us for a good period of time.
Cleveland Clinic's Dr. Ardashir Hashmi says it takes time and meticulous planning. But once you've been symptom-free for 14 days, take a close look at who you're visiting and their health status. According to Dr. Hashmi, there are a number of medical conditions that put an older individual at higher risk for contracting COVID-19, including medications that suppress their immune system, any type of lung or heart disease, and cancer. If your loved ones have multiple conditions that put them at greater risk, the doctor says it is best to reconsider your visit. When visiting nursing homes or assisted living facilities, you're going to want to check and abide by all social distancing and masking requirements. If you're traveling out of town to visit grandparents, be aware of any and all restrictions in that particular city or state as well. And when you arrive, the doctor says outdoor visits are best, but if you must be indoors, try opening a window to increase fresh air circulation. He adds that time spent with grandparents is emotionally and socially beneficial for everyone, but will require extra measures to keep them safe.
Still a visit, but a different visit where the solid core guidelines of frequent hand washing, hand sanitization with alcohol-based preps, safe measures with social distancing, so at least 6 feet away. Wearing masks, I think, absolutely key.
For families traveling long distances to see older relatives, Dr. Hashmi says it's a good idea to carefully think through logistics. He says traveling by car may mean fewer interactions and less exposure to other people. Also, be sure that proper safety measures have been put in place by hotels and airlines that you may encounter along the way. Carolyn Bruck, WCNC Charlotte.
Millions of Americans continue to file for unemployment every week during this pandemic, and today the U.S. Labor Department releasing new numbers, and they are not pretty. On top of the millions of people out of work, the country's economy shrunk at a historic rate last quarter. WCNC Charlotte's Bill McGinty joining us live. Bill, we are seeing the biggest downturns in American history since the Great Depression.
Yeah, we sure are, Fred. You know, I want to put it in context for you a little bit. You know, Vanessa was just on there a second ago talking about CMS deciding to go all virtual or all remote, whatever you want to call it, instead of in-person learning. And that's a prime example of what I'm about to talk about, because the numbers in terms of the virus cases are surging in certain parts of the country. And so that's going to slow the recovery effort that everybody is anxious to get back to work and everybody wants more jobs. But this virus has a mind of its own, and it is simply slowing down the economy, so much so that the new numbers are not good. For example, I'm going to go over the national numbers first, and then I'm going to touch on North Carolina. Here in the United States, the new jobless numbers, basically 1.4 million people applied for unemployment. That was just last week. That is 19 straight weeks. This is for context now. 19 straight weeks of more than 1 million people applying for unemployment. That's a staggering number there. Economists say with the surging coronavirus, the recovery in certain sectors is really stalling out. Things like the restaurant industry. They were hoping that would roll back to what it was pre-virus, but with the numbers surging in terms of the virus, they're not able to bring as many people back, and social distancing is forcing restaurants to have a very limited number of people inside, at least in the states that are still allowing that. All right, now let me move on to the North Carolina numbers here, Fred. 1,205,371 people applied for unemployment benefits. That's since the spring. That's since this all got started. Now, there's a lot of breakdown in the way the numbers are shaken out, but of that big number, of that 1,205,000, 833,012 people were paid. Now, you're probably wondering, well, why are those paid and why not others paid? Well, some people weren't eligible for unemployment for whatever reason, and other payments are still pending. So there's a lot of gray area in these numbers, and it takes a long while to sit and stare at them and digest what exactly do they mean and how do they affect our individual states, because every state is different. So the big global number of the national number, yeah, that's big and it's staggering, and you're right, we haven't seen that before. But then when you start to get into the nitty-gritty and look at the individual state numbers, you tend to see a different picture because every state is different. Some are faring better than others.
Yeah. And Bill, you've helped lots of people get the resources they need during this pandemic. Where can people turn if they're out of work right now?
Well, we all have, we've been doing this a series, Where's the Money? And so we've been helping people with their unemployment insurance, getting through the red tape. We've been helping people with the stimulus payments. Now, the stimulus money has slowed down again, but I'll bet that ramps back up if there's a second round of stimulus. But what I want to tell people is that WCNC.com, we have a resource guide on there that was put together by our team, and it is very comprehensive, and it'll walk you through a lot of the first steps. Before you have to email us, go through that resource guide and take a look at some of the options in there and some of the questions. A lot of the questions you might have might actually be answered by looking inside that resource guide. And if you still have questions and if you still need help, don't be shy about emailing us. Nate Morabito, Savannah Levins, Michelle Bowden, and Alex Shabbat, and myself, we're all working on this for you.
Yeah, and we appreciate the help. Thank you for that, Bill. And I want to remind you out there, if you or someone you know is out of work, text the word unemployment to the number on your screen at 704-329-3600. You'll get that unemployment guide right to your phone. Vanessa?
Thank you for making WCNC.com your #1 choice for local TV news on your phone and in your home, and trusting us on Facebook by giving WCNC Charlotte more followers than any other local TV news source. Thanks again for making us #1.
Coronavirus cases are climbing in the Carolinas. In North Carolina, for example, an additional 1,200 new cases reported today. And in South Carolina, the state is reporting 1,400 new cases. And as we see more cases every day here, local hospitals are turning to a potentially life-saving treatment. Atrium Health says they've been using the drug remdesivir as soon as it became available. It's been used to shorten hospitalization and reduce mortality for some patients. Other states like Florida are now critically low on remdesivir. So tonight, we're checking on the supply locally and what impacts it's having. WCNC Charlotte's Alex Shabbat diving deeper into that story. He joins us now from Atrium with what he's learning.
Well, an Atrium doctor tells me remdesivir is showing promising results. It's meant for the sickest patients, but it's just one of several tools in the toolbox. There's no cure for COVID-19, but hospitals are taking steps toward treatments, and Atrium Health was among the first in the region to offer remdesivir to patients.
We've been using that for, pretty much as soon as the trial became available.
Dr. Catherine Passaretti, an infectious disease specialist at Atrium, sharing the results they've seen so far.
Early data is promising that it's helping those sickest of the sick people.
It comes as several hospitals in Florida say they are critically low on remdesivir. They want an expedited shipment of the drug and a new distribution process to avoid backlogs, which they say can mean life or death in some cases.
We have seen the number really in the last 14 days grow from 200 patients to 400 patients.
Earlier this month, Dr. Passaretti talked about Atrium supply.
And luckily through the state have had an increasing supply lately.
She says in some cases, steroids are combined with remdesivir for the best results.
So remdesivir is an antiviral agent that kind of attacks a virus,
using that either in conjunction or separately with steroids, which kind of calm down the immune system.
Doctors using what they can to save lives in the short term as they remain hopeful for a vaccine longer term.
It's unlikely we will have a vaccine with significant distribution before, at best, early next year.
Doctors tell me they're also using a technique to keep people off ventilators whenever possible by putting them on their stomach instead of their back, which is meant to increase oxygen flow. In Charlotte, Alex Shabbat, WCNC Charlotte.
WCNC Charlotte News Now.
It's considered one of the best ways to prevent the spread of COVID-19, but contact tracing is not working in Mecklenburg County. It's a story we worked on with Charlotte Journalism Collaborative. The health director told the Defender's Nate Morabito she's not convinced it's the best use of resources.
Health department investigators are trying to do old school detective work, calling hundreds of people every day, people who tested positive for COVID-19 or are likely exposed, urging them to voluntarily quarantine. But they can't make them stay home, just like they can't make them answer the phone call in the first place, listen, or be honest.
It's quite frightening.
Rick Winokur spent the weekend at the ER with complications from a recent bout with COVID-19.
My experience on that, I'm grateful to be alive.
Just one of many frustrating moments in his coronavirus journey.
My own anecdotal experience left me a little shaken in terms of how vigorous the county is being in its tracing efforts.
Another, the fact it took Mecklenburg County case investigators almost 2 weeks after he tested positive to call him.
It's one thing saying you're doing efforts at tracing. It's another being actually good at it.
While he wanted to talk to the health department about his experience and contacts, others aren't as eager.
They're hanging up on staff sometimes, not answering the telephone, and there have been occasions when staff have been yelled at because people are tired of this.
Health Director Gibby Harris is frustrated by the lack of community cooperation.
I'm also concerned about how much time and energy we're spending trying to contact people.
She says those who are COVID positive and willing to talk about it are sharing the names of fewer and fewer contacts.
Whether it's they're trying to protect their friends or whether they don't want their place of work to be heard or whatever it happens to be, the number of contacts is shrinking.
Mecklenburg County has long used case investigation and contact tracing to effectively prevent the spread of tuberculosis, HIV, and sexually transmitted diseases. Diseases with far fewer cases, meaning if you can't get in touch with them, you can go out and find them and then issue a mandatory isolation or quarantine order. With coronavirus, there are too many cases, along with limited community cooperation and no real enforcement.
We're hearing people who say, thank you for the information, but I've got to work.
At the recommendation of the CDC and state, Mecklenburg County stopped issuing mandatory isolation and quarantine orders early in the pandemic. As people like Rick Winokur continue to deal with the long-term impacts of COVID-19, Harris says something has to give.
Whether we either slow down on the contact tracing or whether we crack down on the enforcement. There's two different ways you could go with that, I think.
We could copy other countries, but it would come at a cost to our privacy. South Korea uses cell phone and credit card data as well as surveillance video to track and then trace COVID-19 patients, and then shares that information with the public. A little bit closer to home, it's well documented. Paterson, New Jersey has had great success identifying a large percentage of its COVID-19 patient population and then isolating them without those privacy concerns. Nate Morabito, WCNC Charlotte.
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The Firstborn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The First Warn Storm Team will be there for you.
Speaking of school, good morning, everybody. Colleges are getting ready to reopen all across the country, and now more than 6,300 cases of COVID-19 are linked to them. Here's a new survey. Take a look at the map here. Everywhere where you see these dots across the country, that's an amount of COVID-19 cases that were tied to about 270 four-year public colleges, and it includes 94 cases linked to App State, and also classes that are planning on, or schools that are planning on going back to in person this fall. COVID-19 found in a science building at Western Carolina. Davidson, they put together this visual that you see here, and it shows how schools are handling reopening. 87 of them going online, 95 in person, 51 a mix of both, 38 still deciding. And both online and in-person schools do have a number of major outbreaks. Also, there's concern over sports, what we've been talking about on the show. And you can see here, several of them in our area have COVID-19 cases in their athletic departments. 47 at Clemson, 37 at UNC, 5 at NC State, 27 at East Carolina, and 5 at UNC Charlotte. So join the conversation this morning and let us know what you think school for college students should look like this fall as they get ready to return. We have our options of in-person learning, all remote, a mix of both. For the last hour or so, it looks like the majority of you guys have been leaning toward in-person learning. So we'll continue the conversation with our hashtag WakeUpCLT. Ben, back to you.
A good half of folks saying that they prefer in-person learning when it comes to colleges. I just look at those numbers that she just shared with us, showing the numbers they already have on campuses, and it's like, wait, they're not even back yet. I mean, what's it going to look like,
I know.
A month or so from now?
And listen, I do get that we wish it wasn't like this. We wish it was normal and people could just be on campus just like they are every other year. But we are not living in normal times right now. I do think that universities, everyone needs to give at some point. It is difficult when you hear that there are some universities who are not reducing fees, even if kids are going primarily all online. So things need to change on all aspects for this to work out, and just keep people healthy, because that's the #1 priority here.
Time now to connect the dots when we make the news make sense. As we mentioned, gyms, bars in North Carolina will not be allowed to reopen until at least September 11th. Of course, that is just heartbreaking and frustrating for a lot of small local businesses. Research shows going to a bar or going to a gym, some of the riskiest things we can do right now.
North Carolina now just one of 8 states where gyms are still closed. So what's so bad about gyms? Let's connect the dots. We breathe harder when we work out, making it easy for COVID-19 to linger in the air. Doctors also say a lot of gyms have poor ventilation. That's something we know is critical to the spread of coronavirus. Experts say for now, the safest thing to do is to take your workout outdoors and stay 6 feet away from others. Of course, it's not just gyms. As we know, bars too are still closed and late night alcohol sales are limited. That's because we're more likely to forget about social distancing after having a few too many drinks. We're probably also talking louder, laughing, and even singing, all of which can easily spread the virus in the air. And that is connecting the dots.
We're really desperate.
Local business owner Craig Ray applied for a government loan to keep his business going. But when his request got stalled, Craig contacted the defenders and asked, "Where's the money?"
I know that after you contacted them, things moved pretty fast.
Just glad we could help you.
If you're asking where's the money and feeling financial pressure, the WCNC Charlotte Defenders are here to help. Email us at thedefenders@wcnc.com. We're there to get you answers to where's the money, only on WCNC Charlotte.
Turning back now to our coverage of the coronavirus, almost half of all COVID-19 cases reported in North Carolina were reported in July alone. The state has seen 38 consecutive days of at least 1,100 new cases per day. At the state's highest, there were more than 2,400. So it's clear the virus is not going anywhere anytime soon. Joining us to talk more about the coronavirus in North Carolina is Dr. Stephen Hauser with the Old North State Medical Society. Dr. Hauser, the 3 W's, wear, wait, and wash, are still very important here. Tell us more about how the Old North State Medical Society is helping mitigate the virus in vulnerable communities.
Thank you very much. Yes, we actually, the 3 W's, very important for trying to prevent the spread of the virus. As you know, we have no cure, so that's one of the things that we can do to help mitigate the spread. But Old North State is very important in doing this too, because we are actually, every week we are hosting some COVID-19 testing throughout communities to help keep residents safe during the pandemic.
And there seems to be a misconception, or at least a perception that, well, we know that people in our minority communities, Hispanic, African Americans, are vulnerable, but there's a good reason for that. Can you explain?
Well, typically, COVID-19 works, it typically affects lots of people who are underserved. Typically, Old North State Medical Society has been very important in helping, in working with the underserved and rural populations, and these are the populations that are most affected by the coronavirus. And it just so happens a lot of African Americans are in that demographic.
Yeah, and we appreciate your work. Dr. Stephen Hauser with the Old North State Medical Society, thank you so much for joining us this afternoon.
Thank you.
WCNC Charlotte News Now.
All new tonight, coronavirus in pregnancy. So based on what we know so far about COVID-19, the CDC says that pregnant people should be at increased risk or could be at increased risk for severe illness from this virus. But that should not come at the cost of getting proper care during your pregnancy. WCNC Charlotte's Rachel Lundberg explains.
Obviously, we're in stressful times, a little bit different than normal times.
And for women that are about to have a baby, COVID-19 just adds more stress to the mix.
So I have to ask you, because you've reiterated that message a couple times, we'll call and say, do I have to come in or can I stay home?
When this first started coming out and everybody started really kind of freaking out, yes, we did.
Dr. James Hubbard has been an OBGYN in Rock Hill for nearly 20 years. For the first time, he said some patients were trying to cancel their appointments.
And people who had an infection needed to come in for an injection of antibiotics and said, no, I don't want to come in because I'm afraid of getting coronavirus.
Dr. Hubbard says we have to realize other diseases didn't just take a vacation.
Things that we deal with in pregnancy, especially in North and South Carolina, diabetes in pregnancy, hypertension in pregnancy, preeclampsia in pregnancy. These are all really serious problems, and it didn't go away. And the risk of those are higher than the risk of COVID.
Backing that up, the safest place to deliver is at the hospital.
Another thing is, again, a lot of people afraid to go to the hospital. They're taking every precaution. You're safer there than going to Walmart.
What are you advising for your patients whenever, or just anybody that's about to have a baby, when they get home and they're released from the hospital, having visitors come and see that newborn?
I think that it's okay for family to do that. Wear a mask, wash your hands, don't handle the baby. On the flip side, they can wait a little while too. It's not an emergency that they can see the baby right away.
For WCNC Charlotte, I'm Rachel Lundberg.
Download the WCNC Charlotte News app and find out why WCNC.com is the #1 choice for local TV news on your phone and in your home.
Time now to connect the dots when we make the news. Makes sense. Most school districts in our area are doing at least some type of online school this fall. While we embrace this new normal, it's also important to know exactly what learning will look like.
As kids get ready for a very different start to the new school year, we're hearing a lot of terms to describe what they'll learn online. And it turns out there's a difference between e-learning and virtual learning. Let's connect the dots. E-learning, or electronic learning, is online instruction by a teacher, where students can join and complete their work at their own pace. This is what many districts did in the spring, allowing families to fit schoolwork in while parents juggle their new work-from-home life. Virtual learning is more interactive. Students join live lessons with their teachers and have the capability to ask questions and even chat with their classmates. Come this fall, you may see a combination of both of these in your child's back-to-school plan, as educators work to accommodate the student and family schedules. And that is Connecting the Dots.
Ben, a big talker on our Facebook page this morning. Despite the decline in COVID-19 cases, Carowinds is keeping their gates closed for now. The amusement park making that announcement yesterday. In a statement, the park saying, "We are disappointed that we are unable to welcome our guests back to the park this season." They went on to say that the safety of our guests and associates is always our top priority. So Carowinds says they do plan to open in 2021. They say season pass holders for this year are automatically going to have season passes for next year. Carowinds also says that when they do reopen, they're going to debut 2 new attractions. One's the Boogie Board Racer, and then the other one, the Grand Carnival. So there is something to look forward to. At least we've got that. Now, South Carolina Governor Henry McMaster did allow for amusement parks and zoos in the state to reopen on May 22nd. Several in South Carolina did reopen, including Family Kingdom Amusement Park in Myrtle Beach, Frankie's Fun Park in Columbia and Greenville. A lot of you weighing in this morning, though, saying that Brenda says, I'm impressed. Good for them, putting safety before profit. My 7-year-old will be ready to go next year, and I will take her, she says. Brianne says that her family just went to Dollywood over the weekend, and she thinks it's totally possible to have an amusement park up and running with safety precautions. Carlos also weighing in saying, quote, keep in mind, Carowinds isn't like Florida parks. It's not open year-round, and most of their business is in the summer. So let us know what you think. We want you to weigh in. Use the hashtag WakeUpCLT. Again, Ben, this is one of those things that Carowinds could reopen, decided not to reopen, and in the statement says it's doing so because it wants to keep the public safe and it wants to keep its employees safe.
So then you look at a reopening for Carowinds sometime maybe in April, May next year, and then you got to wonder, are things going to be different by that point? You know, are we going to have a vaccine? And the honest answer is we just don't know.
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The Firstborn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The Firstborn Storm Team will be there for you.
Coronavirus cases in children are on the rise in North Carolina. This coming as thousands of students in our state prepare to head back to school, some of them for in-person learning in less than 3 weeks. New at 6, WCNC Charlotte Savannah Levins asked a local pediatrician what parents need to know.
As of today, more than 13,000 North Carolina kids under the age of 17 have been diagnosed with coronavirus. As July winds to a close, children now make up 11% of overall COVID cases in North Carolina. That's almost double the 6% overall cases kids represented in late May.
Concerning, yes, but in general, as a practitioner for this area, that COVID cases in general are increasing.
Dr. Carlos Paxtor with Sunshine Pediatrics in Rock Hill says the increase in child cases is mostly to be expected, as more people in general are tested and diagnosed. And kids are still the least likely population to develop serious symptoms.
It's not impossible, but it's highly unlikely.
And get this, even though kids are notorious germ spreaders, recent research by the American Academy of Pediatrics show most kids who get the virus contract from adults, not other children. Now, as families start to get out of the house more, as parents head back to work, more kids are getting the virus. Nationally, child cases shot up by 88,000 between July 9th and the 23rd, a sharp increase of 44%, and not likely to slow in the Carolinas with schools set to resume in August.
Do we expect an increase in the cases? Absolutely.
Dr. Paxtor says parents shouldn't panic. Kids still make up about only 8.5% of all cases in the U.S. and less than 1% of deaths. But he says reinforcing good hygiene both at school and at home will be critical in the coming months.
The precautions are not just in the school where you don't want to catch it, but also when you return home and how you approach everybody else, especially the people who will be more susceptible.
Also important to note, research shows kids under the age of 11 are about half as likely as adults to spread coronavirus. Meanwhile, kids between 11 and 17 are just as likely as adults to spread the virus, even if they're asymptomatic. Reporting in Charlotte, Savannah Levins, WCNC Charlotte.
Yeah, Fred, new at 5:30 here. We're talking about mental health and suicide prevention experts saying that we need to take the stigma off of mental illness and really start talking about it. And this comes as we hear state health officials talking about increases they're hearing of anxiety and depression and binge drinking and even opioid overdoses and visits to the ER because of that. So that is certainly a concern for them. Lana Harris is digging into this topic deeper. Lana.
Well, the expert I spoke with says that people often look at mental health issues like anxiety and depression as something that they can shrug off or get over when they can be huge red flags for suicide.
We're in a crisis.
Vonda Bryant isn't talking about the coronavirus crisis, but the suicide crisis.
People don't really think it's a big deal. They think it's isolated incidents, and they have no idea how many people are dying every day.
Bryant trains people in suicide prevention and says in North Carolina, the numbers are astounding.
Every 6 hours, somebody dies by suicide in our state.
And North Carolina Health Secretary Mandy Cohen recently announced that factors contributing to suicide have only increased during the pandemic.
We are seeing concerning evidence of sharply increased rates of anxiety and depression in North Carolina, especially amongst younger people.
Bryant says in speaking with teens who've attempted suicide or knew someone who had, she's noticed a trend.
They tell me their parents don't listen to them. They dismiss what they have to say. It's like, oh, it's no big deal. You'll get over that.
But with the coronavirus claiming lives and jobs and changing the way of life and requiring more isolation, Bryant says mental health has to be taken seriously.
You have to listen. You have to talk, but you can't be judgmental.
And to help, North Carolina Mental Health Director Victor Armstrong came up with SCOOP.
SCOOP is an acronym that we created to help you remember some helpful tips.
It stands for Stay Connected to Family and Friends, Compassion for Yourself and Others, Observe Use of Substances, Okay to Ask for Help, and Physical Activity to Improve Mood.
And Bryant holds free trainings for adults and youth to become certified in suicide prevention, basically how to recognize warning signs and step in. We have that information on our WCNC app. In Charlotte, I'm Lana Harris, WCNC Charlotte.
Thank you for making WCNC.com your #1 choice for local TV news on your phone and in your home, and trusting us on Facebook by giving WCNC Charlotte more followers than any other local TV news source. Thanks again for making us #1.
Let's talk back to school, and things are changing rapidly. Right now, families once again having to change plans for the school year. CMS announcing that it's switching to an all-remote learning, at least to start the school year off. Wake Up Charlotte's Chloe Leshner joining us live. So, Chloe, CMS says they simply had to change plans because they are short-staffed.
Yeah, good morning, Carolyn. Teachers said they did not feel safe going back. 70 teachers said they would not return this school year, and dozens of school bus drivers, nurses, and custodians said the same. The school board voting unanimously to ditch those first 2 weeks of in-person learning.
None of us are expendable on the ideas of learning comes before anything. It doesn't. Safety comes first, and then come learning.
Some teachers feeling a weight lifted off their shoulders, their demands answered as the CMS Board of Education decides to scrap their original plans and start the year virtually.
Teachers and students rise to the occasion. So I think that we're going to do a really good job of onboarding. And onboarding is really what's going to take the bridge the gap between not seeing our kids in person in school versus being virtual.
Some students will get to go into the school building. 20,000 kids in the district have special needs, and virtual learning doesn't work for all of them. CMS will provide an in-person instruction opportunity to some of those students when they're able to. The decision to go all online, changing plans once again for parents.
I look at the school as an education. I didn't go to school to become a teacher, so I have no idea how to teach my daughter.
This whole experience, a lesson for board members.
We cannot make a decision this monumental in the future without listening to educator voices and listening to the people on the ground.
And CMS is pushing for teachers to work from their classrooms, but they have the option to work from home if that's what they are most comfortable with. Now, obviously, a lot of this is going to fall onto parents. Educators are pushing for there to be an orientation for both students and their parents on the whole virtual academy. Live at CMS headquarters, Chloe Leshner, Wake Up Charlotte.
All right, Chloe, thanks.
WCNC Charlotte News Now.
As we keep tracking those coronavirus numbers, local doctors are doing the same within their own offices. One doctor we have talked to runs a testing site in Dilworth for Triumph Medical Partners. She says she's seen the number of people getting tested double and triple within the past 2 months. Our Michelle Bowden shows us the numbers that testing site is battling with.
Triumph Medical Partners has been running this testing site since March, and they say the numbers they're seeing now, not good. And they say it's primarily young people who are surprised when they test positive and can't figure out where they got the virus.
The rise in cases is just outrageous.
Dr. Jennifer Womack runs the Dilworth testing site for Triumph Medical Partners. They had been seeing 30 patients a day back in April and May, and even considered closing the site down in June. Now, though, they're seeing 100 patients a day.
After the 4th of July weekend, it's just been out of control. The number of people that are sick or asymptomatic and spreading it to their family members is it's just crazy. The virus has mutated at some point and it's less severe but more contagious. I'm not seeing as many critically ill people that need to go to the hospital or who are having low oxygen, but I'm seeing the number of people in total has just dramatically increased.
And the problem and the number of cases is amplified because results are taking longer to come back and people aren't quarantining while they wait.
That has been a huge problem for us, is the turnaround time.
Womack says it is very frustrating as a frontline worker.
Pretty disappointed. I feel like I've made a pretty significant personal sacrifice, and so have all of the staff members here. You know, we've put ourselves and our family members at risk by coming here and doing this. It feels sometimes like people are due, but at what cost?
Some good news here. We had been reporting for months about the shortage of both PPE and testing kit supplies. They say it's not really a problem for them. They'd love more N95 masks, but other than that, supplies are okay for now. Reporting in Charlotte, Michelle Bowden, WCNC Charlotte.
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The First Warn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The First Warn Storm Team will be there for you.
In other health-related news, we've been seeing this huge undertaking. We have this mask giveaway where Mecklenburg County Atrium Health, they've been partnering to hand out 2 million masks to people in the community who need it. So today, we saw them partnering with a local builder to donate masks to a small construction company and other construction businesses around the area. Chloe Lester has more.
Construction is an essential job where it's harder to social distance. That's why there's an effort to get these masks in the hands of construction workers.
Good morning, miss. How are you?
Trying to keep coronavirus numbers down within the group of people putting new buildings up in the Queen City.
We have 100,000 masks to give away. On the left.
There have been several coronavirus outbreaks at construction sites in Charlotte throughout the pandemic. The county especially concerned about the Latino community.
You find a lot of the minorities doing a lot of the labor type of work and a lot of service and things, so they've been more exposed.
The latest data from the county shows about 3 in 10 reported cases are Hispanic people, and most of them are younger adults likely working essential jobs. This giveaway targeting smaller construction businesses who otherwise may not be able to provide their employees with masks. The county has been working to get information out into the Latino community, so facts and tips are included in every bag.
Many times they travel in the same car. Use masks. When they get together to have lunch, use the social distancing. When you go to the gas station, make sure that you put hand sanitizers afterward.
Good morning. For some who stopped by, slowing the spread is personal.
It's just a mask. It's not going to hurt you.
As they watch family members battle the coronavirus.
It's been emotional. You know, he gets better and then he goes back down. So I don't know. It's really important for us to be safe.
Atrium also has masks out at several different locations in the community for anyone to get for free. We have a full list of where they are on our website and mobile app. In Charlotte, Chloe Leshner, WCNC Charlotte.
Time now to connect the dots when we make the news make sense. Sports are making a comeback. Baseball's back, no fans in the stands. Future of football still up in the air. This all may seem unprecedented, but our grandparents or great-grandparents have been through this before, actually.
Sports are slowly returning amid this pandemic, but with new rules and precautions. And it turns out we've actually seen this before. Let's connect the dots. There have been all sorts of comparisons between the coronavirus and the 1918 flu pandemic, and that includes sports. In 1918, the NFL wasn't around yet, but the MLB and the NHL were, and they did play games with some safety measures in place. In the MLB, the season started as scheduled in April 1918. Some players wore masks, and the season had to be ended early. The World Series was actually blamed for helping spread a new strain of the virus in Boston. College football went ahead in 1918, but the season started later and was shortened. At least 18 teams sat out the season. Fans were at the games, and many wore masks. As the pandemic continued, more sporting events were canceled, including the 1919 Stanley Cup Finals after players on both teams were hospitalized. And that is connecting the dots.
really desperate.
Local business owner Craig Ray applied for a government loan to keep his business going. But when his request got stalled, Craig contacted the defenders and asked, "Where's the money?"
I know that after you contacted them, things moved pretty fast.
Just glad we could help you.
If you're asking where's the money and feeling financial pressure, the WCNC Charlotte Defenders are here to help. Email us at thedefenders@WCNC.com. We're there to get you answers to where's the money, only on WCNC Charlotte.
Tonight, a shocking sign of the times. Utilities across North Carolina have held off on disconnecting water, electricity, and natural gas for more than 1.3 million customers in recent months. And that's the equivalent of every person who lives in Mecklenburg County and then some. The Defender's Nate Morbido learned the economic crisis is forcing the state to step in and help. He's asking, where's the money?
The governor is finalizing a plan that will help people with their utility bills. In the meantime, the state is extending its moratorium on disconnections until September. Tiffany Givens is a single mother.
My assignment ended July 2nd.
And now she's out of work and waiting to collect unemployment. And it's the end of the month.
I need to pay August rent. My car note and car insurance are due also. Like everything is due around the same time.
For the first time since this pandemic started,
this past month I haven't made a payment.
She started defaulting on her bills, and her family's future is uncertain.
To have 2 kids in tow, living on the streets, that's not ideal.
This is not just her reality.
My bills done doubled up, lights, water.
It's the reality for hundreds of thousands of people. Take Charlotte water customers. The most recent state data show 55,000 customers, or 21%, are past due, with more than 15,000 of those people more than 36 days late, considered delinquent and eligible for disconnection. The agency doesn't have numbers to compare to this time last year, but others do. In Union County, more than 7,500 water and wastewater customers, or 15%, are past due, compared to just 421 in June 2019. And in Lincolnton, 531 accounts, or 10%, are considered past due, compared to just 175 in June of last year. Just this week, the North Carolina Utilities Commission offered yet another extension to those facing disconnections, banning cutoffs for 1 more month.
My administration is putting in place an effort to help people with their rent and utility bills.
The order buys Governor Roy Cooper time to implement a relief plan.
The idea of this CARES Act money would be to make direct payments to utility companies.
Struggling families know this won't solve their problems for good.
You can only tell them to hold everything but for so long until they say, hey, you go, you're sitting in the dog.
But it should provide temporary comfort.
I'm an adult with 2 kids. I don't want to impose on anyone else.
A chance for Tiffany Givens to get her financial situation in order, and a chance for her kids to be kids and not face adult problems.
I don't want them to be too concerned and worried about this because, school is coming up. I want them to focus on, school.
There's also a ban on late fees. State records show North Carolina utilities have not charged $31 million in late fees and penalties since April 1st. Nate Morbido, WCNC Charlotte.
Staggering numbers there. For more information on help with your utility bills, rent, and other resources available to you, head over to WCNC.com/money.
WCNC Charlotte News Now.
North Carolina now reporting its first death related to a childcare coronavirus cluster. This comes as teachers, parents, and students gear up to return to school this month. So what do we need to know if we're sending our kids back to class or daycare? Tonight, our Vanessa Rufus explains the risks of a childcare setting in a coronavirus world.
The death is tied to Washington County child care facility Grace-Filled Beginnings, and it involves someone on staff. At latest check, 8 staff members and 2 children there are infected.
It's a sad reminder of the infection risks when groups get together indoors. North Carolina's first death tied to a COVID cluster in a child care setting since the state began reporting that information in late June. So far, at least 22 places have made the list, including 6 in the Charlotte area.
And in limited contact tracing studies, children don't seem to transmit to adults the way that adults can transmit to children.
But transmission from kids is still possible. Last month, Atrium Health Levine Children's offering up insights from its pediatric experts.
It's important to keep the teachers socially distanced and masked as well, because if there's transmission among the teachers, then there will be transmission to the children as well.
The state has guidance as well as requirements for childcare, mandatory measures including posted reminders to socially distance, daily symptom screenings for anyone entering the building, sanitizing surfaces frequently, and masking for anyone 11 years and older when they can't physically distance. Some pediatricians even put the mask cutoff as young as 2.
There's power in establishing social norms, that shape what we and our children may accept as the new normal.
And there are at least 2 local clusters that are considered ongoing. Mecklenburg County's KinderCare Providence and Iredale's Primrose School of Lake Norman. Vanessa Rufus, WCNC Charlotte.
Download the WCNC Charlotte News app and find out why WCNC.com is the #1 choice for local TV news on your phone and in your home.
This year, your kids' back-to-school needs will look a little different. There might be more technology on their list than you're used to, but with everyone needing high-tech gadgets, are there any left? WCNC Charlotte's Tanya Mendes takes a look.
For many families, back to school will mean back to the dining room table and back to fighting over the technology. Well, if you don't have all the equipment you need, it's getting harder and harder to find these in the stores. We walked into a Charlotte electronics store Monday, and it looked like they had computers, Chromebooks, and laptops. Dozens on display, but actually only a handful in stock. Across the country, laptops and tablets at the top of everyone's virtual learning list.
We are seeing a lot of customers who need laptops and desktops. We're trying the best we can to get the inventory in that we can.
Demand soaring for families and schools trying to get the tech they need for a remote start to school.
Everyone is buying iPads and Chromebooks, and vendors are delayed.
In Union County, Superintendent Dr. Andrew Houlihan says they hoped to have new Chromebooks for each student in 2nd through 5th grade. But some of those new Chromebooks now won't be there till October. Kids will use old technology instead.
So I think the growing technology buildup and the volume that the globe is really trying to procure right now is also currently a challenge.
Scoring a computer, only part of the challenge, though.
You can have the device, but if you don't have the internet, it won't matter.
This new connectivity report from the North Carolina Department of Public Instruction found that between 250 and 300,000 students in North Carolina do not have access to the internet at home. CMS hoping to provide hotspots for every family that needs one. Same for Union County. But the superintendent says the biggest challenge is supplying the demand.
We've really been trying to problem solve around those issues.
Mobile hotspots like these are going to be critical for families who don't have internet access. Union County Superintendent tells me they purchased 3,000 of them. I'm Tanya Mendes, WCNC Charlotte.
Well, a lot of Carolina college students are moving back to campus this weekend, but things are looking a lot different. WCNC Charlotte Savannah Levins has the latest.
COVID's not loosening its grip on the Carolinas, but for many college students, the show must go on. NC State students start moving in this weekend with safety measures in place. Other Carolina schools prepping too. Elon University mailed testing kits to all 7,000 students ahead of their arrival in a few weeks. App State also reopening for in-person learning, but mandating masks in all classrooms. Clemson requiring all students and staff to be tested for COVID 5 days before returning to campus. Many schools eager to welcome students back, but with the pandemic in mind. A New York Times survey discovered at least 6,600 COVID cases connected to 270 colleges. A new study from Yale researchers found to open safely, colleges need to test students every 2 days, a frequency that far exceeds current CDC guidelines. College students, staff, and parents hoping the guidelines on campus are enough to keep students safe. Savannah Levins, WCNC Charlotte.
Tornadoes to tropical storms. Severe weather is extreme weather, and we're here to keep you safe and to help you navigate your day.
The Firstborn team is there for you, no matter the conditions and the location.
We're in your hand with the WCNC weather app, and we'll always be there on WCNC Charlotte.
So wake up, plan your day and your life. The First Warn Storm Team will be there for you.
Time now to connect the dots when we make the news make sense. Dozens of companies in multiple countries racing to be the first to create a COVID-19 vaccine. But it turns out when this thing finally comes out, some healthy competition is not what we need.
The race is on to find a vaccine for the coronavirus, but global competition to find one could spark another problem. Who gets it first? Let's connect the dots. There are close to 200 vaccines in development around the world, and researchers say at least 2 of them have produced immune responses in patients. Here's the problem, though. One of those is being worked on by British scientists. The UK has already paid for the first 100 million doses produced, and the U.S. government has made a deal with Pfizer to get 100 million doses of its vaccine. This all works for countries that have money to invest in a massive undertaking like vaccine research, but there are a lot of countries that don't have those resources. But that's not just a problem for them. As we've learned, viruses don't respect borders. An ongoing outbreak in one country can be a threat to the entire world. Public health experts warn we need to come up with a plan to make sure everyone has access to a vaccine to end the threat to us all. And that is Connecting the Dots.
Now, it's the first weekend of a statewide ban on selling alcohol past 11 p.m. in North Carolina. And as you can expect, business owners who depend on late night sales aren't too thrilled about it. New tonight, WCNC's Brandon Golder talked to some local business owners who tell us what this is like for them. Brandon.
There was a famous commercial of yesteryear. It's 10 p.m. Do you know where your children are? But with the pandemic, we can now change it to it's 11 p.m. Are you holding a beer? Case Warnamundi owns Old Town Public House in downtown Cornelius.
We were just starting to pick up a little bit here. I think people are more comfortable with coming out, and now we're definitely heading in the opposite direction, which hurts.
As a bottle shop, it's technically considered a retailer, so it's allowed to be open. While Mecklenburg County launched its own alcohol curfew last week, Cornelius leaders didn't sign on to it.
Putting the responsibility in the hands of the businesses, trusting that we're going to do the right thing.
But with the governor ordering businesses to go cold turkey every night at 11, he has to follow it. And being a bottle shop that doesn't sell food, less late night, less pints, less profit.
We need people in here to sustain our business, to make our employees money, since they, mainly make money off of tips.
Mecklenburg County Public Health is also relying on tips, as in complaints. Public Health Director Gibby Harris will be announcing a plan with CMPD and other agencies to outline specific, consistent ways to enforce those